but also checking with the assemblies and government on what has been done to address these perennial issues. Let's go to the Bono East region now, because the region has recorded its first case of coronavirus, bringing the total number of regions that have recorded COVID-19 to 15. Now, Bono East Regional Minister Honorable Kofi Amoakohene disclosed this during a media briefing at the Kintampo Health Research Center. The case was detected in Yeji in the Bono East district, involving a 31-year-old man who drives from Yeji to Kumasi. Anasa Bit was at this press briefing and has come through with the following report.
The Bono East region has become the 15th region to record a COVID-19 case since Ghana recorded its first case in March this year. The region has since conducted a total of 1,393 COVID-19 tests with 506 results received. Bono East Regional Minister Honorable Kofi Amoakohene disclosed this at a media briefing held at the Kintampo Health Research Center Thursday.
Our routine surveillance has captured 154 cases. Total negative 144, that's 144. Awaiting results 10. And then the enhanced surveillance. Total samples taken 1,239. Results available 362. Negative results, that's tested, 361. Positive results 1. Results pending 877. And then routine and enhanced surveillance put together. Total samples taken so far is 1,393. Results available or received so far is 506. Negative results is 505 and 1 positive.
The first case, a 31-year-old driver who plies the Yeji-Kumasi road, is part of samples taken as a result of enhanced routine surveillance conducted by the Regional Health Management Team.
Concerning the case, that's 0. Male, 31 years, resident at Yeji. Contact identified so far is 8. Still engaging the community. And the one is under our care in a quarantine facility.
The region is currently awaiting over 880 results with its statuses yet to be established. Reporting for JoyNews, Anas Sabit, Kinta.
Let's go to the Bono region now. We've been joined by the Regional Health Director, Dr. Fred Adumako Boateng. Thank you very much, sir, for your time here on NewsDesk. Let's start with this first case you have recorded. How is the patient doing and how are you managing the situation?
Okay, so the patient is currently with us in one of the facilities that we are managing. And then he is one of the people that falls into the criteria of asymptomatic.
Okay.
As we are aware, when people are confirmed of having COVID-19, we break them into various categories for purposes of management. The first one is what we call the asymptomatic. Basically, they don't show any signs and symptoms of the disease. The second one is what we call mild, the moderate, severe, and critical. But he falls into the category of asymptomatic. Well-able-bodied man, moving about, doing everything. So currently, that's how we are managing him back to the facility.
Now that you have your first case, the likelihood of a spread is very, very possible. You're already awaiting 880 results. I don't know if you have some in already and what the indications are.
Okay, so just to give a background to this particular case, where you look at Bono East, based on the routine surveillance that we were doing. Initially, remember that we were taking samples when people came to our facility, and they gave us a set of symptoms that we thought they were likely to have COVID-19. So before this enhanced testing, we have picked almost 154. But looking at the locality of Bono East, we thought, look, and looking at the way this disease is presenting, it's better we do detailed search. Let's look more and see, because if you look at this country, one of the regions that is potential, have a potential for outbreak is Bono East, strategically, Kachiman, one of the largest markets in the West Africa, a capable market.
Yeah.
So we decided that because of that, look, we will do what we call enhanced testing. And we just deviated from the routine one where people were coming to us. If you like, we say as kind of surveillance. So we categorize the people in the region into the high-risk people. And by high risk, we're saying that if anybody was going to get COVID-19 in Bono East, it's likely to be one of the commercial drivers, because they are exposed to a lot of people, health workers, food vendors. And Bono East is having about 11 districts. So when we use the census, we saw, look, we could pick about 889 samples. And across the Bono East, we took the samples for all the districts. So it's just like, in this particular case, when we are about taking samples, he said, oh, I'm not sick. We said, yes, we know, but we really want to verify that, look, the cases that we are not recording, that is the true picture.
Yeah.
And lo and behold, when the first set of results came, 197, everybody was negative.
Okay.
It was the second set that came, that one is positive.
Okay.
So currently, as we are speaking, they are bringing in the report. So we search and look at it.
And
so
this
report
report
is more of enhanced testing that we decided to do and
Okay.
take this case up.
So this report that you're waiting includes the 880 people.
Yes. So
Okay.
it's 1,239 so far, and then for the enhanced, and then we have the 300, over 300 that have come in now.
Okay. So it appears that you have been somewhat proactive as far as COVID-19 is concerned. Can you tell us about your treatment centers, for instance? What is the capacity you have? And where are you doing the testing? Are you taking it up to Tamale or bringing it down south to Kumasi? How are you able to test these people? And what is the timing like? How early are you able to receive the results?
In fact, all our samples were sent to Tamale. You know, the heavy loads in Kumasi and Accra. So we decided for this time, let's go to Tamale because they are likely to get it faster.
Okay.
So all our samples are at Tamale. And then, as we are speaking, we have also been able to identify the contacts, especially the close ones, which we have also taken samples.
Okay.
We have also even quarantined some of the contacts in some of the quarantine facilities. So that is what we are done.
Okay.
Bono East, we selected some treatment centers, and one of them is Kintampono. In fact, if we are looking across the country, and a model treatment center is at one of them is at Kintampono.
Okay.
So it's actually built by U.S. Army. They use the infection prevention control principles in building these treatment centers, the risk and the high. So for that place, we can pick about 14 cases. And not only that, we also have a very big completed. I don't know whether it's timely or God-given. We can pick about 800 cases over there. So 80 cases. So we have prepared, not kind of more than that, but for now, we have the capacity to be able to. Now, even when you go to Pro East, we are just having some rapid response meetings, thinking through what has happened. They can also manage 6 mild cases at Pro East at St. Matthias Hospital. So these are the things that we are now doing, and then we are fashioning out the strategy going forward.
That sounds good, but let us look at the preventive protocols and the social distancing, wearing of face masks. Do you see compliance, adherence to all of these protocols?
That is the challenge. That is the challenge. Adherence to social distancing and wearing of the mask is a challenge. And I think it should be a border for all of us. Because initially when the cases started, only 2 of them COVID in Greater Accra. And for you to get COVID, you have to travel across the country, let's see, for want of better word, come to Accra. But currently, as we are speaking, we have over 5,000 cases, which means that the likelihood of having COVID-19 is also so high.
Yeah.
So it means that, look, and now I was having some discussion with other people. They said, what are we doing at our borders, making sure we don't have... I told them, look, this case is within. Now the cases are within. The enemy is within. So far as we are tightening border and all those, we should also make sure that the preventive measures that will stop transmission from a person to person is that. And this is a collective responsibility.
And I can imagine that this will change your education strategy, because now you have a case, and so you would have to you have to take a look again at how you are educating people, and you perhaps have to intensify your education as well.
Okay, so, and that is where it's a shared responsibility. As I am discussing this issue with you, I don't know the number of people that are wearing masks at your studio or your facility. And for us to come and tell you the benefits of wearing masks, it's for the 2 of us now to continue enforcing and encouraging each other to wear it. Somebody was saying, why don't we enforce it? How can maybe people will take a taxi, trotro? How can you get people each coming?
Well, there's an example in Kumasi where the police is helping to enforce this. But I want to thank you so much, Dr. Fred Adumako Boateng. That's all time will allow us for now. We'll return to the region when we have an update. But let's go on to Zoom now and speak to our correspondent there, Anas Sabit. Anas, how are people reacting to the news of the first case being recorded in the Bono East region?
To most of the people we've been speaking with from yesterday,
Apologies, we have some bad connection there to Anas a bit. We'll rectify that once we have a good connection. We'll return to him to find out how people are reacting to the news that Bono East has recorded its first case of COVID-19.